pause isn't the same as acknowledging that this is not the right location. HVA has consistently said that we agree with government that this is a healthcare crisis, and our position is that it clearly needs to be dealt with in a healthcare setting. We need the right supports for people. Nobody disagrees. There wasn't a single person in this room that disagreed today with the concept that vulnerable people need to be supported. And in order for us all as a community and as a society to have the best result, that's going to require support such as medical support, mental health support. And we believe that in the government saying it to us over and over again, that it is a health crisis, that the best place for it is in a place where these vulnerable people have access to doctors, to nurses, to mental health professionals, to direct lines to detox.
Okay.
And it is not appropriate to put them unsupported in neighborhoods with no support system around them.
And why is that? What is the impact? What are the issues that people who are part of the hospitality group are being concerned with?
Yeah, so whether it's our organization or what we heard today from leading organizations from across the business community in the Lower Mainland and here in Vancouver was that it is absolute chaos. There's street disorder, open drug use, violent crime, petty crime, break and enters. Vancouver is seeing unprecedented levels of effect from this very significant situation that we are fighting, and the opioid crisis cannot be denied. I think we heard today from speaker after speaker after speaker, whether it was Roy Schrin at Destination Vancouver quoting statements made by tourists to Vancouver, whether it was Chief Constable Steve Rye giving statistics about violent crime, the rise in violent crime, as well as calls for service throughout the districts where these OPS sites have been previously tried and failed. It's clear that these have a massive disruption, and we need to be thoughtful. And when we go into a community, it is the belief of Hospitality Vancouver Association, and I believe from all of the other associations represented today, that there needs to be clear, transparent, and meaningful consultation. That meaningful is not a single meeting with a select group and without any of the supporting documentation. And it is our position that these centers really do need to go to medical facilities in order that the vulnerable people that need their services are able to get the correct services.
Those issues you raise around the impacts on the community, are they not already there? I mean, does not going ahead with an OPS, does it remove the fact that people are addicted to substance and are using substances and have all those domino effects?
Right. So what we heard today from the Chief Constable was at the site, the previously failed site on Seymour Street, they saw an immediate 51% increase in police calls for service and a 13% increase immediately after that facility was open in violent crime. So there is no doubt that the lived experience in Vancouver at both of the previous two sites, and I can say specifically from Hospitality Vancouver Association, the previous site to the one that's being proposed now at 900 Helmcken, we saw a dramatic and instant increase in crime across all areas of criminal activity, including very violent crime, when that facility opened. And so we heard from the Chief Constable that in fact the day that these open, that they see spikes in criminal activity. And so I think that should be concerning to us all.